Hello, everybody, and welcome to part 8 of our psychoeducational series. My name is BJ Harvey. I'm an occupational therapy graduate student currently working with the mental health services as a part of Kansas Team Health. Today, we're going to talk about a relevant topic for college athletes, and that topic is substance use. In today's video, we will introduce the substance use spectrum, what substances athletes report using the most, why athletes use, potential negative effects of substance use, signs and symptoms of abuse, and next steps for managing substance use regardless of where you fall on the spectrum. Also, stay tuned for other upcoming videos that will cover specific topics such as cannabis, alcohol, and nicotine use in more detail. People use substances such as controlled and illegal drugs, cannabis, tobacco and nicotine, and alcohol for different reasons, including medical purposes, religious or ceremonial purposes, personal enjoyment, or to cope with stress, trauma, or pain. Substance use is different for everyone and can be viewed on a spectrum with varying stages of benefits and harms. The best way to avoid any harms from substance use is to avoid use. Many people use substances without causing significant harm to themselves or others. Beneficial and lower risk use includes casual, recreational, and limited use. However, in some cases, there may be no level of beneficial use or lower risk use, as substances can have a serious risk of harm at any level of use. For instance, children and young adults are especially vulnerable to the effects of different substances because of the impacts on their development. The brain is not fully developed until the age of 25. Therefore, a substance can have more of a risk of harm for those under the age of 25 and those with medical conditions. We'll talk more on the impacts of substance use later. Higher risk use or misuse is using for the purpose of getting high or drunk and engaging in risky behavior, such as impaired driving and binge drinking. Addiction or abuse is using frequently in spite of impaired functioning or daily use required to function or feel normal. It is harmful misuse which can lead to negative physical and mental side effects. As of January 2024, these are the most up-to-date statistics regarding student athletes and substance use. Alcohol is by far the most commonly used substance in the student-athlete population, with marijuana, vapes, and other forms of tobacco following closely behind. On the lower end of the spectrum are things like heroin, amphetamines, and anabolic agents, better known as steroids. So for those who do use substances, why do they use? This graph is specific to cannabis use, but the reasons why can be said for multiple other substances. Oftentimes, athletes use substances as a means of fun or enjoyment. Other reasons include relaxation, improving sleep, as a coping strategy for mental health issues, to be social, physical pain management, and peer pressure. In addition to this, it's important to note that doping to improve athletic performance and boost recovery is also a reason for use and is considered substance abuse, although not mentioned on this graph. When substances are being used as a way to cope with things like anxiety, depression, pain, and sleep, this is when problems arise and abuse is likely to occur. As someone is using the substance as a maladaptive coping strategy, which can, over time without treatment, become a dependency problem. Drugs, tobacco, and alcohol have different effects on a person depending on factors like the substances being used, tolerance, sex, age, weight, and any other underlying health conditions. There are many potential negative impacts that substance abuse can have on an individual. These negative impacts may include decreased cognitive function, academic issues, increased symptoms of anxiety, depression, and any other mental health conditions, issues with athletic performance, including potential suspension depending on the drug, issues with personal relationships, and finally, the most detrimental is the increased risk for serious health issues, which, if not addressed, can be fatal. As indicated by the DSM-5, these are some signs identifying criteria that would signify someone may have some substance abuse issues. These include a need to increase consumption, partnered with an increased tolerance, unsuccessful efforts to decrease substance use, a burning need to use the substance impedes on daily life and ability to fulfill obligations, and there are symptoms of withdrawal when the substance is not used. These are some strong indicators that someone may be having some substance abuse problems. Substance misuse and abuse are serious issues that can have devastating effects on both physical and mental health. However, there are several strategies that can help individuals overcome their use and start the journey to recovery. The first step is seeking professional help. A trained expert can provide the guidance and support needed for a successful recovery process. The KU mental health team is a great starting place if you aren't sure what kind of help might be needed. As a reminder, we are a confidential resource available to student athletes at no cost. Another important step is to build healthy social support systems. Surrounding yourself with positive, understanding people can make a significant difference in staying on the path to recovery. Additionally, it's crucial to identify and address any underlying emotional or psychological issues that may have contributed to substance abuse. Developing healthy coping strategies like mindfulness, therapy, and stress reduction can help individuals manage these concerns without turning to substances. Lastly, it's important to find positive replacements for the substances being abused. Engaging in healthy activities, eating nutritious food, or forming connections with supportive groups or individuals can all serve as positive alternatives. These are the first critical steps in the fight against substance abuse. By taking action and seeking support, recovery is achievable. The path to recovery from addiction is possible, but it looks different for people. Some people may benefit from non-use, whereas others may need different support, which could include medication, counseling, withdrawal management, and wraparound services, such as employment and housing to support longer-term wellness. Resources are available to help people struggling with substance use. With the right supports, it is possible for a person to improve their health across the spectrum. If you're having any trouble with substance misuse, abuse, or any other mental health concerns, please scan the QR code and schedule an appointment with one of the members from our mental health team. In addition to this, we would highly recommend you attend our Recovery and Injury Support Space, or RIS, where we can further discuss the topic of substance abuse and help you out in any ways possible. Thank you all for listening to this video, and I hope you have a great day.